The patient is focus of everything we do within the cancer field. Karolinska Comprehensive Cancer Center has further improved involvement of the patient by bringing together cutting-edge expertise in highly specialized cancer care and basic translational and clinical cancer research. But how do the patients feel themselves? What is the experience as a patient, relatives, and employees? Please listen to some of the voices.
I think the greatest possibility is now that we are setting the structure for patient involvement, how it should be on all levels, both in projects and on different types of levels, even in research. And when we have done that, set that, we also have to find out what type of knowledge do these patients have to have. So I think that's a challenge, but it's a big opportunity.
Challenges can be turned into an opportunity, and it's about how we do that. And I often think that starting to work more multidisciplinary, that we work as a joint combination with patients, next of kin, bereaved, with different disciplines in the hospitals, nurses, physicians, researchers, that multidisciplinary thought creates the opportunity of new solutions. And I think that's beautiful.
Myself have the opportunity to be involved as well in the lung cancer. As a patient, I've been able to follow what's happening from a patient perspective, and they are listening to me as a patient, and that's very, very useful.
Patient involvement and patient influence on the process we are building are extremely important. We are trying to get the patients involved from the beginning. But they are not only important to have when we are creating the process, they are part of the process, of course, because they're their treatment we want to improve and to get the new techniques, the new methods in order to cure more patients or to give them a longer and better life.
I think that's another very important part, that patients have the opportunity to be involved in the research from the very beginning.
I think that when we started this, there was a huge distance between the hospital and the university. And I think that's a pity, because we are in this, that we should use the method that we can learn from research in order to develop the future care. So I think that when it comes to research and the Comprehensive Cancer Center, that has made a huge impact on how we actually start to collaborate.
So now that we have a structure where we have a common vision between the university and the hospital for how to take care of cancer patients in the best possible way, we are now in a unique position to integrate all of the activities that are required for a patient involvement, precision medicine, in the whole chain of diagnosing disease, treating disease, caring for the patient, informing about lifestyle factors that are important for the rest of the patient's life. So one vision for the future will be that a newly diagnosed cancer patient will be put in a path where we will, together with the patient, both perform research on the tumor and on the patient's health and the symptoms, along with the diagnosis and the treatment, to have a more comprehensive, if you will, care for the patient. I think this is key for the future.